Let's open up those hips. Open up those hips. 10 seconds here, y'all. 10 seconds. 10 seconds. It's just regular people doing amazing things. All right, let's jog in place, guys. Jog in place. Shake those arms out for me. Come on.
Getting good at running is a personal process. It's different for everyone.
Let's go. Let's go.
And here, different is part of the victory.
People are kind of looking like, we ain't never seen this before. Beautiful, beautiful. Good work, y'all.
A running group made up almost entirely of Black runners.
I think it's just something that's really never been presented to us. This hasn't been pushed in our culture to, hey, try to run a marathon, try to run a half.
Zone Fitness Training Run Club started in Houston in 2017. Theo Murdaugh created the Dallas group in March of 2020. They meet 3 times a week to run, be social, and build community. In 2022, 22 ZFT runners ran their first full marathon. 15 ran their first half.
I mean, we got people 2 years ago that probably couldn't even run a quarter of a mile, and they're going on their second, third marathon.
And nearly 3 years into a health crisis that exposed gaping disparity, each of those miles represents small strides in closing the gap in their communities.
I think people really started getting serious about their health, saying, I got to find a way to get in shape. What health issues run in the Black community, right? It's hypertension, it's high blood pressure. Hypertension runs, through my family, sickle cell.
Health issues we started calling underlying conditions when they made COVID-19 more dangerous for people who have them. But these chronic illnesses were already here and killing Black people disproportionately.
The disparities of especially chronic medical conditions is not new.
Dr. Carol Lee Estelle is the Associate Chief of Infection Prevention for the Parkland Health and Hospital System.
High blood pressure they call the silent killer. Why do they call it a silent killer? Because you don't feel anything, but it can be ongoing.
Parkland received more patient visits for hypertension, commonly called high blood pressure, than any other chronic illness over the last fiscal year. On its own, it's harmful, but hypertension is also the leading cause of heart disease, which has been the leading cause of death in the U.S., Texas, and Dallas County for years. And Black people have died from heart disease at a higher rate than any other ethnic group over the past 20 years. Late last year, Parkland and Dallas County Health and Human Services released this report. It's a deep dive into the health issues for Parkland patients and Dallas County as a whole. These were the leading causes of death in Dallas County in 2020. Black people have outpaced all other races in 6 of them, with 5 being chronic illnesses. And it's been that way since 2016, years before the pandemic. Want to know what else they have in common? Preventability. The CDC's top recommendations for them all are to stop smoking, eat healthy, and move your body.
In 2020, I was probably the heaviest I've been my entire life. I had gained 50 pounds.
Rakia Ankar is a therapist. When the pandemic started, she shouldered her clients' fears and her own.
Okay, this being, how short I am and 50 extra pounds, does that make me obese? Am I putting myself at risk?
But the big push for her health journey was losing her mother to breast cancer that year.
There's a strong, hereditary gene or something in our family. It was very difficult to see her go through that because it was so sudden.
She joined ZFT months later. Now she is training for her second marathon. And that's not all.
So I'm down 40 of the 50 pounds that I gained. I would say joining a running club to me brings a calmer, safer space.
And that space part is important. Feeling safe in your neighborhood, money for a gym membership, even access to fresh foods, all luxuries not afforded to everyone. This group is just one of the resources created to remove some of those barriers.
I see the ripple effect going through the city with ZFT.
In the Black community specifically, being able to engage with people who look like me, who care about their health,
is huge.
It was our culture, our people, our vibe, our energy.
I love it. That is public health, and they're doing it in a grassroots fashion out in the community.
The journey to getting healthy is personal, but you don't have to do it alone. In Dallas, I'm Morgan Young.